So now I have questions for you, which are also questions for our research, for our challenge. So the first question is, in 2009, WHO convened a ministerial conference to discuss crisis and health. Some of these questions may look naive, but even naive questions are sometimes very important. So the question here is that those were recommendations from WHO for all governments and all international agencies. Look at the recommendations. If I was in New York speaking, I would say, wow. What happens with these recommendations? They were followed up by governments, by international agencies, by the European Union, by WHO. The question is, they were not followed. And the question next to that is why? Why we agree those sort of things that we are not able to follow? And that's an important question because it's going to be another meeting like that in April 2003. Now, next questions. In the European treaties, there is a provision that says if you take decisions in other policies, economic policies, financing policies, you should make a health assessment of those policies. What would be the health impact of other policies? That's in the European treaties. Now, in the Troika programs, in our country policies, there was not done, till now, any health impact assessment. Why? Then, the discussion really today is before two kind of thoughts. The first are the structuralists. They say, first, you do internal devaluation. You cut budget, you cut salaries, you cut pensions. So you become more competitive economically. And after that, you grow economically. That's one way of looking at it. Then the other way are the expansionists, that they say, well, you cannot do it sequentially. You have to do it at the same time. You have to try to become more competitive and try to do financial adjustment, but at the same time, you have to leave enough room to have economic incentives to grow. Otherwise, you cannot pay your debts. Okay? So this is the basic discussion going on. But the interesting thing is none of these discussions, none of these agendas, none of these viewpoints has a word about social well-being and health. So health and social well-being is not part of the discussion at all. It's an afterthought. It will happen what will happen. It's not in the table for negotiation. It's not part of the debate. Now, so this is comparing the two views. Now, there is a third way of looking at that, and that is what we can call the public policy harmonizers. They put on the table all sorts of public policies and try to look at the trade-offs between the policies. So, if you have to make financial decisions, you see what the options are, you see what the economic implications of the options are, and you see what the well-being implications are. And you try to see them together so you can have a trade-off analysis that allows you to take the optimal decisions for all the public policies. And of course, then you ask the questions, what kind of health aspiration do we have? What sort of economic growth we need for that? And how we can mobilize resources for health to ensure what we want. So you go around and you trade off and you analyze jointly so you make balanced decisions that harmonize different policies. So you need to harmonize different policies. You need to harmonize country adjustments with European-wide adjustments. You have to harmonize different timings. You have to harmonize the effect of different cultures. And unless we can put our health situation in the table and push for policy harmonizations, we will be always an afterthought. Now, the next question is the following, and I think that's particularly important. Well, we know that. We know what's going on. as I showed you before, sometimes we have subjective information and we try to validate it with objective information later. The information may be patchy, but we have a reasonable good table, a reasonable good feeling what the situation is and what social situation is. So that we can do. What we fail to do, and that's the question, how to do it, what we are failing is the yellow line. What we are failing is to package what we know in a way that we can influence public policy harmonizers, that you can have the joint view of financial decisions, of economic decisions, and of decisions related to well-being and health. Now, we have another problem. In the old days of the Industrial Revolution, there were people in industry that produced wealth. And there were people that wanted health protection and social protections. And then we have a social contract dialoguing between the two. Now, we realized in the last 20, 30 years, the economic focus changed. Now, the people that appear talking with ministers are not the industrialist type that produce wealth. They are the financial types that produce financial benefits. And there is a big difference between discussing health protection policies with the ones that produce wealth, which are interested in health because it produces health, than discussing with financial systems that are not interested in well-being. They are more obscure, they are more opaque, you don't know them, they are not visible, you don't know their names, you don't know what decisions they made. So we have extra challenge. We cannot think that our counterpart is the sort of economy that produces wealth. Part of our counterpart is a more mysterious, a more hidden, a more opaque part of the economic system, which is the financial system. And unless we learn how to take our agenda in both those economies, we are not able to succeed in changing the agenda. Those are the questions. Thank you very much.